Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a comprehensive chat with the Islamic Medical Association. I'm Dr. Shoaib Wadi, and today we will be talking about lupus. But before we start, just a few advices. Alhamdulillah Rabbil Alameen, wa salatu wa salamu ala ashrafil mursaleen, Sayyidina wa Nabiyyina Mawlana Muhammad wa ala alihi wa sahbihi ajma'in. Allah subhanahu wa ta'ala says in the Holy Quran, Ya ayyuhalladhina amanu attaqullah wa kunu ma'as sadiqeen. So Allah subhanahu wa ta'ala says, oh, you believe, be careful of your duty to Allah and be with the truthful. So today I want to talk a bit about honesty. It's one of those things that we take for granted. It's one of those things which we think we're always doing. We like to believe that we are honest. But many times we're not as honest as we think we are. Allah subhanahu wa ta'ala has made it clear to us in the Quran that part of our responsibilities of Muslims is to be with the truthful, to be truthful in all the things that we do. The Prophet ﷺ is reported to have said that when honesty is lost, then wait for the hour. That means the day of judgment. So they paint of a time leading towards Qiyamah when it will be difficult to find honest people, where people will be inherently dishonest. So dishonesty will permeate society. And you could argue that already in today's times, we find that in many ways we're slipping into those habits. Many times we like to think of ourselves as honest, but when we deal with our children, when we deal with society, we're not totally honest. How many times has the phone rang at your house and you told your child, tell them mommy is not at home, or tell them daddy is not at home, or you get stopped because you were speeding and you tell the police officer, I wasn't speeding, I was doing such and such a speed, or you're dishonest in your dealings with a taxman or other things. So these are not isolated things which you can remove from our religion as Islam. As Muslims, we should be the epitome of honesty. We should be the people who, when we look at them, we are taught to be the most honest among society. And we know that Rasulullah ﷺ, even before he was given the prophethood, or before he became a Nabi, he was known as Al-Amin, the truthful or the honest, the trustworthy. So we pray that Allah subhanahu wa ta'ala guides us towards honesty in all our dealings. So moving on to the show, Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum salam wa rahmatullahi wa barakatuh.
Today I have Professor Mohammed Tikli. He's a rheumatologist at Chris Hani Baragwanath Hospital. Assalamu alaikum, Prof.
Wa alaikum salam wa rahmatullahi.
And welcome to the show. And we have Dr. Faiza Nawab. Faiza is also working at Chris Hani Baragwanath Hospital. And she's, the reason Faiza is here, she is a doctor, but she's also a person who is suffering with lupus. And that's our topic today. Today we're going to talk about lupus. So we'll start with Prof. Prof, can you just tell us what is lupus? What's lupus short for, and what is it?
Okay, so the full term is systemic lupus erythematosus, right? And lupus, actually, the derivation of the term is wolf-like. So it's related to the fact that about half the patients, 50% of patients, develop a rash around the cheeks, which looks like a wolf. Right. And so that's where the term comes from.
Okay.
And one needs to just be clear that we have localized forms of lupus and systemic lupus. So today we're going to spend most of our discussion around systemic lupus.
Right. So, I mean, lupus is a condition which tends to affect young people in general.
Yeah, look, of course, not only does it tend to affect young people, but it tends to be more severe in young people. Having said that, we've seen people in their 50s and 60s do develop lupus, but they then tend to have less of the more serious organ involvement.
Usually it's a very serious and life-threatening condition, or, Prof, is it a mild, something which just comes and goes away without causing any major issues?
I think what's really important, and there's this myth that once you've got a diagnosis of lupus, it's kind of a death sentence. And what's important to realize is one size does not fit all. And as we discuss this further, I think we need to look at it in terms of maybe clothes sizes, small, medium, large, and extra large. So, you get a spectrum from small lupus to extra large lupus.
So not one size fits all?
Absolutely. Okay.
Let's go to Faiza now. So Faiza, Jazakallah for sharing your experiences with us. You were diagnosed with lupus, is that correct?
Yes.
Can you just tell us the experience, how it started and what you went through?
So first, when I was 14, I developed a bleeding disorder caused by low platelets. So I was treated for that.
So what did you feel? Did you notice bleeding?
It was just spontaneous bruising that I found all over my body. And then we obviously did blood counts and my platelets were low.
Okay.
So I saw a hematologist for this. So I was treated for 6 years and then I
At
developed...
that time, did they think that this was due to lupus, or did they think it was a separate condition?
No, it was a separate condition called idiopathic thrombocytopenia purpura, which is ITP.
Okay.
Yeah. So 6 years after, I developed the malar rash.
Okay, so the typical rash that Prof was speaking about around the cheeks.
Yeah, and then I actually went to see Prof and we did some blood tests, and then I was diagnosed with lupus.
All right.
But the thing is that I think all lupus patients experience the lupus differently. Not all of them get the same symptoms. I was lucky to actually have the malar rash because that's one of the more visual diagnostic tools to diagnose the condition. Yeah. Exactly. I know patients can go on for years with just having these non-specific symptoms, and if they're treated in isolation, I think the diagnosis will be missed, because something like joint pain can be part of a variety of diseases, not just the lupus itself. And also the symptoms come and go, they don't persist. So what I suggest, if people are unwell for long periods of time, they should document their symptoms clearly, and when presenting to the doctor, give a good medical history so that the doctor can see the full picture, you know, of what they've been going through over the years, and not treat symptoms in isolation. Maybe that would help, you know, coming to a diagnosis.
When you were given the diagnosis of lupus, obviously were you already a doctor at that time, or were you training?
No, I was around 20.
Yeah, you were a medical student at the time, right?
Yeah, I was in second year medicine.
So you knew a bit about lupus?
A bit, but not that much. Not that much.
So what did you think it was? When Professor Dickley or whoever told you, Faiza, you've got lupus, what was the thoughts that went through your mind? What does it mean for you?
I think because I was suffering with an illness from about the age of 13.
The ITP.
The ITP. So I was a patient for a long time, and it was just almost like a progression into something else. And that actually resolved when the lupus was diagnosed. I mean, my platelets corrected, and I've never had a problem with them ever since. Okay. So it was just like a progression from one disease to another. And obviously, when I read up more about it, and I did experience other symptoms, like a lot of the joint pain I'd had.
So when you thought back, you mean after your diagnosis, when you thought back?
Yeah, during that time, as I was experiencing the symptoms, I came to learn more about the disease itself, and then the medication I was being put on. And yeah, being a doctor, obviously, or basically studying to be one, obviously made a difference, because it gave me much more information on most of what I was going through. So that really helped.
So, I mean, Prof, going back to how Faiza presented, so I mean, it's possible that the platelet problem was already part of the lupus some years before that.
Sure, yeah.
And is that, lupus sometimes presents in many different ways.
Sure, and you know, it certainly can present with an ITP type of picture, and yeah, so, and that can resolve but it can be also a predictor of people getting kidney lupus, which we'll talk about a little later on.
I mean, one of the things about lupus is people say it's a great mimicker. It mimics lots of different conditions.
Yeah, and yeah, it can mimic many conditions. It can mimic rheumatoid arthritis. It can mimic, in our context, and especially in where I work, it often is mistaken for HIV, and people get stigmatized because of that. They lose weight, they lose hair, and there's bouts of fever. And if I recall, maybe Faiza doesn't recall, but when she first came to see me, I think she had lost quite a bit of weight. She had bouts of fever, and maybe she's forgotten she had the vasculitis on the palms. Okay. So. The constitutional symptoms are very important. This feeling of being unwell, and the fatigue, the tiredness. In fact, the tiredness, we can talk about that with Faiza a little later, is one of the symptoms that's actually the last to get better and the most difficult to treat in a sense. Yes. And it has major sort of social implications, especially if you're a young mother like Faiza. You've got home responsibilities and perhaps professional responsibilities.
People think you're lazy.
Precisely, yeah.
But in fact, the fatigue can be debilitating.
Absolutely.
Absolutely debilitating. I think one of the things that you alluded to is that it tends to affect women more than men. And if there's somebody out there who thinks they may have lupus, what are the type of things which you would think they should look out for?
Well, I think, apart from the so-called constitutional symptoms of fever and weight loss and so forth, the things we look for particularly are, do you actually feel worse when you go out in the sun? Okay. What we call photosensitivity. And photosensitivity is not only restricted to getting, say, a rash around the face, but it's actually the feeling of tiredness.
The sun makes you sick.
Sun makes you sick. And lots of patients are actually misdiagnosed as having a flu. So they'll go to the South Coast or Mauritius for a holiday. They've been in the sun for a week. When they come back, they feel fluish. They go to the general practitioner. The practitioner says, and you've got aches and pains. Oh, it's a flu. And in fact, that can be the first presenting feature of systemic lupus. Yeah.
Yes, and I mean, obviously, it's one of the fairly classic features of lupus, having that photosensitivity.
Photosensitivity. Yeah. The hair loss is also important, Yes. Yeah. The joint pains do come on, and probably if we look at, certainly in our experience, 70% of patients will have joint pains, although not everybody will have joint swelling, probably about 50%. But joint pains are exceedingly common in these
so
patients.
Not necessarily a full-blown arthritis,
yeah,
but pains and discomfort in the joint.
Oh yeah, and
it
aches
can
and
affect any
muscles.
joint, Prof?
Well, predominantly, the hand joints and the large joints like the knees and elbows. Maybe Faiza, you can fill in there, but hand joints and that's why it can mimic rheumatoid arthritis.
Okay. Yeah. So I mean, then obviously, people go seeking care for arthritis.
Yeah.
And sometimes they self-medicate with anti-inflammatories and so forth and so on.
Sure. Yeah. Yeah. I think one of the we should talk about this, that whilst we want to make a diagnosis of lupus early, we shouldn't fall into the trap of overdiagnosing lupus. Sure. And perhaps we can talk about the test that is often used to screen for lupus, and that is the anti-nuclear antibody test.
So let's go to that, yeah.
So the anti-nuclear antibody test, firstly, just to say, it's been around for now about a half a century. It's in the patient who's got lupus, or in a group of patients who've got lupus, 95% of them will have the antibody.
I'm just going to stop you there. Let's go just a step back, I think, because some people who are watching may not understand. So when we talk about lupus, we talk about it as being an autoimmune condition.
Precisely.
So there's an immunological basis to the condition. Can you just go through that before we go to that?
So the immunological basis for this disease is that essentially our immune system is there to fight off bacteria and viruses.
That's what it does, yeah.
So an analogy would be our firearms to the bacteria and the germs are pointed outwards. Right. What happens in lupus is, for some reason that we don't totally understand, some of those arms and ammunition they face in the wrong direction. Right. And so they attack the self.
So it's autoimmunity.
Yeah, so auto meaning self, immune, so autoimmune disease.
Right.
And there are many types of autoimmune disease, but lupus is probably the best example where it can affect most organs in the body. So of course the joints it can affect, the kidneys, and you'll tell us a little more about the kidneys. Yeah. The skin is important. The skin and the joints are perhaps the most common type of problems. We can have involvement of the lungs, sometimes the heart, sometimes the brain as well, and people can present with mental confusion and so forth. But I really want to make the point that when you do develop symptoms, it does not mean you're going to develop the total all of the symptoms. Every patient is kind of different. Yes. So let's go back to the anti-nuclear antibody test, right? So the so-called ANA test. So 95 to 99% of patients with lupus will have that antibody. Yes. However, and this is really important, if you did the test on a group of otherwise healthy people, or people who've got minor aches and pains, right? It only is specific for lupus in about 13 to 15%. So in 85% of the cases, if you do the test without actually looking at the patient carefully, it's not going to help you in the
It's a red herring.
It's a red herring. And those people shouldn't be treated. To give you an example, if you look at first-degree relatives, in other words, siblings or parents or cousins of with lupus, 15% of them will have an anti-nuclear antibody tested positive, but will never get lupus. So we shouldn't be hung up with this idea that if your ANA is positive, you have lupus.
Okay. So I'm going to stop you there. We're going to take an ad break, and inshallah, when we get back, we'll get into a bit more detail, and inshallah, invite you to call in as well. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to Health Matters, where we're talking all things lupus with Professor Mohammed Tikli and Dr. Faiza Nawab. And we were talking about the utility of the ANA test. But obviously, so the diagnosis doesn't rotate around the ANA test. It's a diagnosis which is made using a combination of clinical and serological tests, and also sometimes the experience of the examiner is important there.
Sure. Yeah, and we look at different organs. We look at whether there's skin rashes, whether there's arthritis, whether there's any protein leaking in the urine to suggest inflammation in the kidneys, whether there's perhaps fluid around the heart or the lung, what we call a serositis. And then the blood test, the full blood count is a very important test for us. As Faiza said, in her case, it started with low platelet count.
Yes.
But most lupus patients will actually have a low white cell count.
Leukopenia.
Leukopenia, specifically, the lymphocytes will be low. So those are simple tests. They cost probably 180, 200 rands.
Which can really guide you.
Yeah, and as I teach my younger folk, I say, if you see a young person coming in with an arthritis that looks like rheumatoid, and you've got a low lymphocyte count, think lupus.
Think lupus carefully.
Carefully. And the good thing about it is the lupus arthritis tends to get better, if you treat it early enough.
Yes. So we're going to talk a bit about that with Faiza, but I just want to invite people to call in. The lines are open and the numbers will be displayed on the screen. So if people want to call in to speak to Professor Tikli or Faiza, please feel free to call in. Faiza, we're talking about how it affected your life when you just got diagnosed. But obviously you were still quite young. And one of the things that we find is that in younger people, they really struggle to come to terms with the diagnosis, because it's a period when your life is really going through lots of changes. You may be about to get married or getting married, you're studying, building a career, sometimes you're getting ready to have children. How did you deal with some of those things?
So, as I said earlier, I was diagnosed when I was 20, so I was in second year of medicine, and my first flu was actually during the final exams. And I went through this exam.
I'm going to interrupt you. We have a call. Assalamu alaikum wa rahmatullahi wa barakatuh.
Oh, my name is Pakistan.
Yes, we can't hear you too well, but carry on. Let's see if we can pick up the question.
Sorry, Mom. I was...
With a very poor quality call, so we've lost that one, but maybe she can call back, inshallah. So you were saying, Faiza, that you were diagnosed when you were 20 and you were in your second year medical school.
Yes. And so obviously I was put on high dose of steroids, and that comes with its side effects as well. And I had a flare during my exams, and I managed to somehow get through it, because you don't quite know what is going on at the beginning. You have...
when you get the flare, you mean?
Yeah, you just feel so unwell, and you're sick, and you have this mild headache, and you're tired all the time. But I think with the adrenaline of exams and you're studying, you just get through it. And
Did you pass?
I passed.
Alhamdulillah.
That's why I'm not. Yeah. But it was stressful. And then you realize that stress plays a really big part in this disease. And
so I'm going to interrupt you again because we have another call. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam. Can you hear me?
Yes, we can hear you.
My name is Yasmin, and I've been diagnosed with lupus for the last 2 years.
Gee.
I'm on a lot of medication and in a lot of pain. So I just wanted to know from the doctors, is there anything that I should be doing? I think there's a standard kind of medication they're giving us, but I think we're getting worse.
Prof, you want to ask any questions?
Yeah, perhaps you can give us a little more details about yourself. How old are you? What type of lupus do you have? In other words, what organs have been affected by the lupus?
Okay, I'm 47, and I think it's systematic lupus. It is also, like you said, initially rheumatoid arthritis, and then the doctor said lupus. And yeah, so it's just, and I'm on methotrexate and all of that medication, Arava, and it's been a bit tough because it's for a while now and a lot of pain.
So do you have mainly joint problems, as I understand you?
Yeah, mainly joint problems. I had a problem with the. I had to do a hysterectomy, and there was a little bit of infection around the chest and that, but no serious organ damage.
But and you don't have any skin rashes or?
Yes, I do.
What kind of skin rash? Around the face or?
Around the eyes, the face.
Okay.
Skin feels very flushed and buzzed all the time.
So maybe, sister, you can listen on the television, and we'll try and address some of those issues.
Jazakallah.
Yeah. So perhaps at this point, then, just to say that as I said, there's the small, medium, large, and extra large of lupus. So if you're looking at joint and skin disease, for the most majority of patients, it's a kind of small
to medium.
Yeah, small to medium. Okay, and what that implies in terms of treatment is that we would use medications like antimalarials. In this country, you have chloroquine, which is either Nivaquin or Plasmaquin. That often helps, and we can talk about the benefits of that later on. Then, of course, we might use a small dose of prednisone, but only a small dose, and probably maximum of 7.5 to 10 milligrams of prednisone. And then, of course, if the arthritis is bad, to use methotrexate, we would use methotrexate. We don't generally use Arava in patients with lupus. But obviously the doctor who's prescribing it would be using it. If we then go further up, so we're going now to the medium. So in the medium category would be people who have, in the small is the skin problems. So the skin problems are usually treated by the dermatologist. They would use a variety of topical steroids. And again, the idea is to minimize the body's exposure to steroids. Okay, or to prednisone. Then in the medium category, we would use what we say 1.5 milligrams per kilo of prednisone, at most. And
so a bit more prednisone.
A bit more prednisone. So in the region of 20 to 30 milligrams. And we would obviously use a medication like methotrexate or azathioprine as what we call a steroid-sparing agent. Okay. So if a patient's got a pleural effusion, if they've got this vasculitis on the palms, those are the patients where we would use the higher dose. Yes. And then we go to the large. And the large is when you have a problem like ITP, yes. When you're getting to the kidney. Kidney is going from large to extra large kind of thing.
We've got quite a few callers, but just to summarize, for this lady who called, Prof, she would be in the small to medium. But even though sometimes the disease can be controlled, the pain and other things can be separate issues that you need to deal with separately besides the...
Absolutely, and one needs to determine where the pain is originating.
Whether it's from the disease itself, or
and is it from the joints or is it from the soft tissues? Many patients with lupus can develop what we call secondary fibromyalgia, for instance, and the treatment for that is somewhat different from just
so
from
that
the lupus.
Would be addressing the pain more than
precisely
inflammation.
Yeah.
We've got a few callers on the line. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello.
Hi.
Hi. How can we help you?
Okay, my name is Kay. I would like to find out. Okay, I was diagnosed in 2010.
Yes.
And I'm 34.
Yes.
I have a kidney lupus.
Yes.
So I have been taking medications for it's been like 7 years now, and obviously some medications have side effects.
Yes.
Like weakening bones and stuff. So
yes.
I have been reading up and considering taking like your Chinese herbs. What's your take on that?
Okay, Prof, you want to speak about that, and maybe I can say a few things.
Yeah, so I think firstly, just to say from my point of view, a lot of these alternative medications, whilst they may work, they're largely unproven. And the big concern is not whether they work or not, is what their side effects are. And maybe Dr. Wadi is going to tell you more. You know, some of the problems with these alternate medications is that they can be in themselves bad for the kidneys. So I'll stop there.
So the problem with alternative medicines, as Professor Tikley has put out, is that there's no standardization and rigorous testing of them. So, I mean, we've had patients who've been on alternative medicine, and when you look at some of them more carefully, actually some of them are just cortisone, or some of them are high doses of cortisone. On the other hand, we've had patients who've been taking certain specific Chinese herbal teas and so forth, which are known to be toxic to the kidneys and have caused significant damage to the kidneys. And then similarly, we've had patients who've had some success. The problem is it's a hit and miss approach, and you're taking a risk where you're not really sure what the medication is doing, whether it's interacting with the current medicines that you're taking, which is also a possibility. And there are many medicines that we use for kidney damage which have some quite narrow therapeutic margins, where the drug levels can be affected if you take certain other medicines with them, like cyclosporin and so forth and so on. So my advice to you would be to, if you have got those medicines or you're contemplating taking those medicines, to take them to your doctor and have a frank and open discussion. And then also, obviously the reason you're taking these medicines is that you're unhappy or you're unsatisfied with what the lupus is doing to your kidneys. And it's a common problem. Lupus in the kidney is a severe and unhappy complication of lupus, and the treatment is not perfect, but there may be other options which your doctor has not explored or discussed with you, and maybe it's something you need to do and discuss with them.
Perhaps I just want to. Thanks.
Okay.
Perhaps I just want to pick up on this point that you're making about the side effects and so forth. And you know what we now realize in terms of the long-term outcome in lupus is that beyond 5 years, most of the problems that we see in lupus patients arise from the medications.
Okay, that's true, yes.
Yeah, so prednisone, for instance, whilst it's excellent in the short term.
And she mentioned that it causes a bone problem.
Bone problem. But beyond 5 years, we start running. That's not to say we don't use it. We use it for flares, and we use it in the lowest possible dose. But prednisone, just to give you an example, it can not only cause osteoporosis or bone loss, it can increase the risk of heart disease, increase the risk of diabetes. And so, I think that's where the challenge is, and that's where you need the expertise of a person who understands lupus to balance things. And, with many chronic diseases, you don't get perfect control.
Yes.
I think that's what we need to appreciate.
I mean, I think, Prof, you alluded to it, and maybe Faiza can come in as well. One of the problems with lupus is, you mentioned you want someone who understands lupus, but even the world experts have major difficulty making solid, predictable decisions on every single patient. And we know, for example, in kidney disease that the recurrence rate is very high, the relapse rate is very high. And every time a person relapses, you almost have to go right back to the beginning and give them a lot of steroids and so forth and so on. So more and more people are becoming hesitant to take patients who've had serious lupus flares in the kidney off medication completely. They leave them on something. So we're going to go to an ad break, and then we'll come back and discuss a bit more about management of this complex condition. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back. We've been discussing lupus with Professor Tikley and Faiza Nawab, and we've had quite a few callers. I apologize, we haven't been able to take all the callers. Some have had to drop because we've just had, to try and get through some of the discussion, and it's difficult otherwise to break the discussion for callers all the time. But I welcome, please call in, and we'll try and answer your questions if we can take them. Faiza, just to get back to you, I was alluding to the fact that, lupus can affect your ability to get pregnant or your pregnancies, and also, obviously, you were not married at the time when you were diagnosed with lupus. How did it go when you, for example, when you got married? Did your husband know beforehand? Did you tell him? Did you make a point of explaining the condition to him? How did it go with you?
I think he did know beforehand, because I'd had a flare previously, and I had known him from before he was my brother's friend. So I think he probably knew, and everyone else knew that I had this condition and I had been sick before. So he did know about it, and I think it was important for him to know about it, because once you're married, it's your husband who mainly goes through a lot with you. And inshallah, you'll be rewarded for it. But, you know, it's more that he understands what it's all about. And then obviously when decisions are made regarding pregnancy, they need to understand the complexities around that as well.
And then if he knows that before you married, obviously, then it's important. Then he has some insight as to what's coming, that it may affect pregnancies and so forth and so on.
Yes.
And how did it affect your pregnancies?
Well, lupus in itself, I don't think affects your ability to fall pregnant, although it is a high-risk pregnancy once you are pregnant, and the complications of the pregnancy are more of a concern than anything else. So I have 2 children, and my first pregnancy, alhamdulillah, went very well. It was smooth sailing all the way, and I had no issues, which is why we didn't expect anything in the second pregnancy. But now in retrospect, when I look back, I don't think the difference was that I don't think I was completely in remission the second time. Although I was off medication and I was feeling really well, there were small signs throughout my pregnancy with the protein in the urine, and I became quite anemic, and there were issues with the baby.
So we're going to get back to that. We'll take a caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.
Wa alaikum salam.
Professor Tick, I would like to question Professor Tickley about assuming that viruses live in your system, especially in the gut, and that affects your immune system, and that cause lupus.
Okay. Prof, you want to answer that? Just to correct you, not so much viruses, but you're right, there's something called the microbiome, or there's a whole lot of bacteria, but predominantly living in your gut, and we know it does affect your immune system. But Prof, maybe you can answer.
Okay. So there are actually 2 parts to it. The microbiome obviously is the buzzword these days for most chronic illnesses, and you know the thinking is that the composition of the broad composition of the bacteria we have in the bowel predisposes you to certain conditions. Mm-hmm. But I think at this stage, we're really not sure how to interpret this, whether this is cause or effect, whether the alteration in the bowel flora is a consequence of the illness or the cause of the illness. So I think I'll leave it there, and I think, you know, the use of probiotics and so forth certainly have not been shown, at least to my knowledge, to make any difference to lupus. Yeah. However, the other bit, the virus bit, is very interesting. And one of the things about lupus is that a lot of the symptoms are due to a substance, a molecule that is actually produced in viral infections, and that is type 1 interferons.
Yes.
And it's the type 1 interferons that cause the infection, the inflammation. In fact, one of the interesting observations about lupus is lupus patients seldom get colds.
Yes.
And the reason they don't get colds, and maybe Faiza, you want to confirm on this.
High all the time.
Yeah, so they've got this antiviral substance in the blood called the interferons.
But people have looked for viruses as a cause.
Oh yes, yeah,
it is still possible.
Yeah, a virus trigger, you know, Epstein-Barr virus has been looked at and so forth. But again, it seems that they light the fire and then don't have to be around. So treating a viral infection is not going to, I'm afraid, help the lupus. Yeah, but an interesting question.
Yeah. So Faiza, just to before we get back to you, Prof. So viral infections per se, as you say, are not the cause, or we haven't identified one, but it's possible that there may be a virus which could be identified in the future. Is that possible?
Yeah,
which may be,
or there could be a number of viruses, you see, together. Because they act on what they call toll-like receptors, and that triggers off the inflammatory process. But talking about a different type of virus, and this is important in the lupus patients, because as we are moving away from using high-dose prednisone, we are more and more inclined to use what we call steroid-sparing immunosuppressive agents, such as cyclophosphamide, methotrexate, azathioprine, and mycophenolate or Cellcept. All of those agents, one of the side effects is shingles.
Yes.
And that's become a problem. And certainly in some countries, you know, the richer countries, they're almost now, as a preventative measure, giving the vaccine against zoster. when a patient develops lupus or is put on to
prevent them from developing shingles, which can be quite debilitating.
Absolutely.
On its own. So Faisal, just to get back, we were talking about your second pregnancy, and during that pregnancy you noticed that there were some warning signs that maybe the lupus wasn't quiet.
I think so, because I wasn't well as compared to the first pregnancy, although...
and you'd been well for many years prior to that?
Yeah, I was. Well, I thought I was in remission. I was off all medication.
How long had you been off medicine? For some time?
I can't remember exactly, but I was off medication for some time. Just soon after I was married, I developed a flare and I was put on Cellcept for lupus nephritis. So I'd been on that for a few years, and then I think 2 years after stopping that treatment, I fell pregnant with the first pregnancy, so that went well. And I'd been well ever since then. And for some reason, the second pregnancy didn't go as well as the first pregnancy. I developed complications more after the pregnancy, after delivery, and postpartum complications. The nephritis flared again as well.
Mm-hmm. And as a pregnancy is a known flare amongst other things. And Faisal alluded to some of the things which can cause lupus to flare, like stress, sunlight you mentioned earlier. Can you just mention some of the other things?
You know, pregnancy and lupus is really a topic perhaps for another day to discuss. But I think when we look at lupus and pregnancy, we're looking at the well-being of the mother, but also of the fetus.
Yes.
Okay. So it's important to recognize that. And what Faisal has really emphasized is that we emphasize, or we'd like to get the patient into remission before the patient considers pregnancy. Because if you go into a pregnancy with a flare, you're just going to make things worse. And unfortunately, I think some of the patients we've looked after together, where we've told
it's an immensely difficult problem for the patient to face.
And that's where the spouse needs to really be understanding and understand the seriousness of the illness.
We have another caller. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam. How are you, brother?
We are well, alhamdulillah.
Doc, what I need to ask you, I've got lupus now for 30 years, and I want to go now for Umrah.
Yes.
But I said I'm not allowed to take the yellow fever injection and the meningitis.
Okay, that's a very good question. That's a very good question. Prof, you want to...
Well, I think it depends on what medication you're on. If you're not on any medication, I would think 30 years down the line, your lupus is quiescent or gone into spontaneous remission.
No, the doctor said it's quite, I can't take anything now because I'm taking methotrexate.
Okay, well, that makes a difference. Then absolutely right.
So the yellow fever is a live virus. It's what we call an attenuated.
It's a live vaccine.
It's what we call an attenuated. So the virus is very weakened compared to normal yellow fever. But in
is there anything I can take?
No, but you can get a letter from your doctor to say the risk of yellow fever is really very small, especially if all the people around you are vaccinated. And in fact, a few days ago we had a show, a few months ago we had a show about the measles vaccine, and similarly, measles is a live virus vaccine, and you wouldn't be able to get a measles vaccine, or someone whose immunity is suppressed, you wouldn't be able to get it. But you're protected by the fact that people around you should be vaccinated, so that the chance of it spreading to you is very small. Meningitis, though, is not a live virus vaccine. You can take it. The big problem will be it may not work in you because of your immune suppression. So you could take meningitis, but the chance is it may not work because of immune suppression.
So that's methotrexate is, it's a contraindication. You cannot use the live attenuated virus vaccine. Sorry.
Yeah,
okay, doctor. Highly appreciated it.
So in general, live viruses, and there are quite a few: measles, polio, some of the virus vaccines, and yellow fever and so forth. You can't take, but the non-live viruses you can take them. But the problem is your body doesn't react in the normal way.
Your immune response isn't that great.
Medication. So we were talking about the pregnancy as a flare, Prof, and other flares.
So when we see a patient who's either pregnant...
They've just interrupted me to go to an ad break. So inshallah we'll come and wrap up this aspect after the ad break, and then we'll discuss it again, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back. We were speaking to Professor Tickley about lupus in pregnancy, and I had to rudely interrupt you, Prof. So you were talking about how lupus flares in pregnancy and the issues around there.
Okay, so the first thing is avoid falling pregnant whilst you're having a flare, whether it's a minor flare or a major flare.
Okay.
So that's the first point. And then when the patient's pregnant, we need to take off certain medications.
Yes.
So, for
Very
instance,
important.
methotrexate is a no-no.
Yes.
Mycophenolate is an absolute
Yes.
no-no. The only two medications that are safe are chloroquine or the antimalarials and azathioprine.
Well, we've used cyclosporin in many patients fairly safely in the transplant concept, so that's been used as steroids.
But those are the two, the azathioprine. In fact, the chloroquine, and I want to make this point because we often get asked this question, whether we should stop the chloroquine. There are now many studies that have shown that the outcome of the pregnancy is much better whilst you continue.
So they don't flare up with the chloroquine?
They don't flare, and even the baby's outcome seems to be better. So the other thing we do is we do certain blood tests to stratify patients. This is risk stratification, and we do it with many conditions. But risk stratification both in terms of the patient as well as the baby.
Right.
So we look at specific autoantibodies to see whether the patient is likely to flare, like the anti-double-stranded DNA and some other tests. And then we look at tests that will tell us whether the fetus is at risk. And the fetus is basically at risk of two things.
Is this before pregnancy or when
during the pregnancy? The one problem is that these autoantibodies can cross the placenta, and there are certain ones called the Rho and the La antibodies that can deposit on the conducting system of the heart. And they can cause heart conduction defects and congenital heart problems. And
the obstetrician needs to be aware of this.
Yeah, so, you know, we work closely with the obstetricians on these things. They do now fetal monitoring of the heart, etc. So, but, you know, obviously, if you don't have those antibodies, the risk is minimal.
And then usually the baby will recover from that. Those antibodies, as they disappear, the conduction system will improve.
Well, some of them might have permanent abnormalities. Okay. We are now trying some treatments during pregnancy if we do find problems with the conduction and so forth. And so the other problem that we have is that you get antibodies that are predisposed to clotting, okay? Yes. What we call antiphospholipid antibodies. And the problem in pregnancy is that they can cause miscarriages, premature.
Yes. And that's one of the diagnostic criteria.
Yeah, so in fact, yeah. So and that is treatable, okay? Because what we do is we give aspirin, and we use an anticoagulant called Clexane. And, you know, I must tell you that over the years, we've had, you know, very good results. Okay, sometimes we lose patients. I have a patient that, you know, 25 years ago lost her first pregnancy because of antiphospholipid. And then subsequent to that, we started her on Clexane, and believe me, that time it wasn't easy to get it in the hospital sector. But she's now got 2 children, and they're in their 20s. One is a radiographer, the other one is studying at university. So alhamdulillah, it's very gratifying. And I think, you know, what the point here is that, like 30, 40 years ago, if a lupus patient got married, we would say to them, you can't have a family.
Yes, yes.
And I think we've moved very far from that. Yes, it's not possible that every patient we're going to be able to help, but I think we've done much better than in the past.
Yes. So, Prof, I mean, we don't have much more time left. Let's just, we went through some of the treatments for the milder conditions like the plasmacone and low doses of steroids, and then more serious where you start adding methotrexate and azathioprine. Yeah. Once you get to the quite serious life-threatening complications of lupus, those are the ones where really patients end up taking medicines which are potentially quite toxic.
Yeah, so, you know, especially like lupus nephritis, you know, the patients that you and I treat, those patients have, you know, we know that lupus nephritis is one of the important predictors of long-term outcome if you have lupus nephritis, and usually it's the younger patient. So if you look at the risk of getting lupus nephritis, it's like 60 to 70% if you're under the age of 20. Whereas if you develop lupus in the 50s or 60s, Virtually less than 5% will get. So, you know, it tends to affect the young patient and the patient who's likely to fall pregnant, etc., etc. But coming back to the lupus nephritis, again, there I think we've done a lot better. Let me just give you a global understanding of lupus. So if we look 40, 50 years back, in the developed world, 5 years down the line, 40% of the patients were not alive anymore. If you look now in the developed countries, 90% are still alive, or 95%. And I think the study we did a few years ago is sort of an underestimate. I think even in South Africa, we're probably doing well. Now, that's not to say that we don't have the problems of day-to-day challenges with lupus and so forth. So I think these medications for the lupus, kidney lupus, are important. And I think the point you've made earlier is very important, that there's a high relapse rate if you don't continue the treatment. So these steroid-sparing agents like Cellcept,
especially young people.
Young people, they have to continue it for a long time. And unfortunately, and this is particularly a problem amongst young patients, because the prednisone works so quickly, they almost go into a state of denial and say, you know, perhaps the doctors got it wrong. Perhaps it was just a viral infection. Perhaps I just had a kidney infection and they've misdiagnosed it as lupus.
Also, it's a tough time of their lives. You know,
absolutely.
They're pretty young people. Yeah. The people around them are not affected with the condition.
Yeah. So I think you know, there's a lot of effort that we have to make in terms of understanding the chronicity, the long-term consequences, and that, you know, whilst you might get better in the short term, it's the long term that we're really concerned about. And so the Cellcept, in that, you know, you need to continue it for many years. And Faiza, maybe you can add to this, that the minute you stop the Cellcept the one time, you had a flare, right?
Yeah, so the medication is important, and I know a lot of patients find it difficult to continue with it. It does have its side effects and it makes you feel miserable, but we need to understand that it's there to control the condition, to prevent progression of the disease, to prevent, you know, to slow the damage to organs, and we have to see the benefits in it, and you know, just persevere with your medication. And inshallah, you know, you will get through it.
Yeah. So unfortunately, we've run out of time. But just to sum up, as Prof said, the condition is not the same for every person. Some people will have very mild disease. Some people will have much more severe disease. But the outcomes and the results that people have been getting in the past 10, 15 years are much, much better than many years ago. The medicines are much more tailor-made, much more directed. There are better medications at the moment. There's less cortisone and steroids being used than in the past. And some of the complications are also less. But it's still a learning curve, and we pray that Allah subhanahu wa ta'ala guides the medical fraternity, guides the scientists, and makes things easy for the patients, so that inevitably we can all have a more successful result. With that, we're going to wrap up. As usual, I'd like to pray that Allah subhanahu wa ta'ala grants all those who are suffering all around the world, grants them ease from difficulty, and all those who are ill, Allah ta'ala grants them shifa. Assalamu alaikum wa rahmatullahi wa barakatuh.